Okay, so this week on Tales from the Table, you're actually going to get a twofer. You are going to get 2 for 1. That's right, ladies and gentlemen, two stories for one. So this is my preface. All right. It is probably the year 2005, and I'm a graduate assistant strength conditioning coach at the University of Hawaii. Now, in the back room behind the office, we had the equipment room where we stored all of the cones, extra types of weights, bands. I mean, you name it. Everything was back there. And it was also kind of our break room as well, where we had a microwave. So anytime we were hungry and we wanted to heat up our breakfast, lunch, or dinner, we'd go back there and pop it in. And this is before I knew how bad microwaves were for you. So it's my break, it's lunch one day, and I go back there to put my food in the microwave. And the microwave was on a credenza that was quite long. It was almost just kind of like a really long dresser, maybe even the length of my massage table here. And I remember one day, I mean, like it was yesterday, that's how profound this moment was for me, where I put my food in the microwave. And what I ended up doing was I just sat down like this, okay, on the edge of that dresser or credenza, whatever you want to call it. And I remember as I sat down here, something pressed into my adductor, my groin muscle, the edge of the desk pressed into my groin muscle. And I remember jumping off, you know, as quickly as I could because I thought it was hot. I thought that I had sat on a tack. I sat on something I didn't understand why there was so much pain in my leg when I sat down. Now, my knees at this point, they've hurt me for probably a solid 10, 11 years, doing anything and everything. And I've, spoke many times about the disappointments in the westernized medical system in diagnosing and telling me what is going on with my knees. It was always, oh, you got tendonitis, you got tendinosis. There's nothing we can do. So I literally accepted that truth. And every day I was running, jumping, playing basketball, squatting as heavy as I could. I mean, I was Olympic lifting at the time, and this is kind of my peak. So my best snatch was around 203 pounds. And then my best clean and jerk was 275 pounds. And those are both decently heavy for, a 170-pound dude, somewhere around there. And I just accepted, my knees are going to hurt. There's nothing that you can do. But sitting on the edge of that dresser after I put my food in the microwave, that was actually my first sign as to what was really wrong with my body. And here's the thing, we are told and we're all led to believe that wherever you have pain in your body, that's where it is. Okay. If I have pain in my back, there's no doctor in America that would think you're crazy for treating that person's back. You have elbow pain, there's no doctor, osteopath, physical therapist in the world that would think you're crazy if you're treating the elbow, right? So when we treat these localized areas of pain and we don't get the desirable result of the pain diminishing or, okay, wait for it, the pain changing, if it doesn't change or if it doesn't diminish and stay diminished on its way to going away, we know that we're in the wrong place. We're working on a symptom. We're not working on a problem. So you think that your problem is knee pain or ankle pain, but ankle pain is actually a symptom of having a tight peroneal complex. Okay. Your peroneal complex, there we go, is going to be this guy right along here. Okay. Look at the ankle. There's no muscle in the ankle. So when you twist your ankle, what hurts? Ligament, maybe a little bit of tendon, but really it's this muscle, the peroneal complex, okay, right along the side of your leg. This is the master and commander of the ankle, okay, the fascia and the muscle. of that area. So we need to really get away from this idea that the pain that you're feeling is your problem. The pain that you're feeling is your symptom. And we need to find the problem in the body that's causing the pain to go into a specified joint. So, my case in point is this story. I had a gentleman contact me. He lived in Miami, and he told me that his knee, his left knee in particular, was hurting so bad that in order to get out of his apartment, he had a cane in one hand and he literally had to hold the wall with his left hand all the way out of his apartment, all the way down, then through the hallway into the elevator and whatnot. He so much pain. And he had gone to the doctors, best doctors in Miami, right? And they told him that he has a torn meniscus. They took an MRI, verified it, just, pointed to this area, and they said, look, this is your problem. This is why you have so much knee pain, because your meniscus is torn. So he had surgery actually already scheduled about a month out. He found out about me through a client. That's typically how people would always find out about me. And he called me up. I said, give me 3 appointments up until you have that surgery for me to get this thing to go away. I'm fairly confident I can do it. So he agreed. He came up his first day, and I noticed that his right shoulder is a little bit high, okay, from him stepping away from that injury constantly, okay? So I worked on his right shoulder, got that to calm down. And then when he ended up getting on the table, I could already see the left foot was turned out. So we know that the glute is tight. I worked on his glute, worked on the hamstring. The hamstring was very tight as well. Then I had him get on his left-hand side, and now I'm going to get into the really good stuff. All right. I got into his adductor complex. Okay. And this is where the most excruciating pain that he's ever felt in his entire life came about. And what I was working on was in what I call the adductor canal. And what happens more often than not in the leg is we have this cylinder, okay, and we have this complex of muscles that has to work together very, very carefully and lovingly in order to make sure that the hip and the knee stay stable. All right. So a lot of times when muscle tissue in the leg starts to get tight, it will kind of reach out or try to phone a friend, okay, and grab onto another muscle. In this case, the adductor can grab onto the hamstring and it can also grab onto the quad. So you have muscle tissue that should be working together, firing separately, but also dependent on each other. All right. And everything's now glued together and firing together when it's supposed to be firing together, but operating independently. You see what I'm saying? And when we have that type of pressure, and then you go and walk or exercise, and you're asking the muscles now to create pressure via an external load, pressure plus pressure equals compression. You've heard me say that in my back pain Bible. Okay. So what was happening was every step he was taking, he was pinching his saphenous and his obturator nerve probably, and both of those terminate right in the patella tendon, right in this portion of the knee where everybody says, oh, I got tendonitis or tendinosis. Okay, all it is inflammation. There's no such thing as those labels. All right, the doctors give you that label so you'll shut up. You go and you research tendonitis or tendinosis on Google, and it's going to be rest ice compression, elevation, maybe some NSAIDs, something like Advil or whatever, Tylenol, and you just accept your fate. But what doctors or other people don't explain to you is the inflammation of that tendonitis or tendinosis is from improper firing pattern. So you get friction in there that you're not supposed to. And then that friction creates greater micro tears in the tendon and the fascia surrounding it. And what do? We get the immune system bringing inflammation into the area to heal all of that stuff. Okay, so by actually putting ice on it, you're prolonging your healing and you're prolonging the tendonitis. If we were to get pressure in the quadricep, adductor, maybe a little bit in the hamstring, okay, now all of a sudden we're opening that tube of musculature and fascia up. Everything is contracting and expanding the way that it should. The kneecap now starts to track much more proper, and we don't have any problems. Okay, so it took me, after his first session, this gentleman was, I want to say 50 or 60% better. Okay. And when I was working on his adductor and I was trying to peel the fascia and the muscle tissue away from the nerve, I mean, my goodness, it felt like it felt like he had a branch like this big, okay, in his leg. I mean, it was just a tube of hardened, held up fascia. Felt absolutely terrible. This is last year, by the way, that I'm talking about this. I want to say last year, 2024, May of 2024, something like that. It took me 3 sessions before this gentleman was 100% pain free. He never got surgery. Okay. And the reason all of this developed was because when he was playing college ball, he tore his left Achilles tendon. So when we tear our left Achilles tendon and we're not able to really put as much force into that foot as we want, what ends up happening, the knee and the knee musculature will now take over, okay, for the lack of whatever that Achilles tendon was trying to do. We kind of have like a broken part of the body, and the rest of the body moving upstream says, hey, I'll take over that little part that old buddy used to do. All right. And it will do that for, infinity, until it has done it so much that there is so much tightness due to what we call an overcompensation pattern, right? That then it starts to create a lot of pain. Okay. And then what do? We take drugs, or we get cortisone shots, or we get rhizotomies or ablations or things like that. I'll talk about those in a separate video and why they're just 100% wrong for anybody. Should never be done. In fact, I think they're barbaric. Okay. So, what's the takeaway from this video? Well, it goes back to when I sat down on the edge of that dresser that we had in the back room at the strength conditioning facility at the University of Hawaii. That was an indicator as to what was really my pain in my knee. And the reason why we will have pain in the knee is because when these muscles are firing that are controlling the knee, when the fascia that's firing, that's controlling the knee, has entanglements in it or knots, okay, or it's weak, a message gets sent into the knee in the form of pain to tell you to stop using your leg, stop using your quad. There's a problem in the quad, please stop using it. But we think that there's a problem in the knee, so we put on a knee sleeve, or we get a knee brace, or we wrap it with an ace bandage, or we put a lot of ice on it. Okay. And this is unproductive. Anytime I see somebody running, playing basketball with knee sleeves or knee braces on, okay, that's a band-aid. And when that band-aid rips off, you're going to have a much, much greater problem. All right. This is the truth mechanistically with how the body works with pain, especially knee pain. So if you're out there, you're having problems, and somebody's told you that it's your MCL, or somebody's told you that it's your meniscus, or you're hobbling around out there, praying that something doesn't break, you better email me. All right. Information is down below, rebuilding you at proton.me. Answer those 6 questions and we can hop on a call and I'll get you going. All right. Hope you guys enjoyed this edition, Sunday edition of Tales from the Table. We got a lot more coming.